Welcome to the Deep Dive. We're here to cut through the noise, get you those insights that really count. Today, we're plunging into something huge. It underpins everything, touches all our lives fundamentally. And to kick us off, think about this quote from Martin Luther King Jr. Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. Wow. That really sets the stage, doesn't it? The moral weight of our topic today, public healthcare. But this deep dive, it isn't just about the ethics, important as they are. It's about how George Bickerstaff sees it. Global healthcare leader, former CFO at Novartis Pharma, chair of the International Vaccine Institute. Big picture view. And he doesn't just talk about it as a safety net. No, for him, it's a strategic imperative. We're going to unpack why he thinks it's the cornerstone for a society that's just stable and productive.
Yeah, and Bickerstaff's framing, it really shifts your perspective right off the bat. Instead of just seeing public health care as, a service you might need sometimes, he argues it's actual infrastructure, national infrastructure, like roads or water or the power grid, essential stuff. And thinking about it that way, it just broadens the whole discussion. It's way beyond just getting medical treatment. It's foundational.
Okay, so given that frame infrastructure, let's get specific about what we mean by public health care, because it's often bigger than people think. We usually think government funding, maybe regulation, but Bickerstaff pushes us. Think universal population health management from the ground up. So it's not just treating sick people, it's everything. Policy driving prevention right through to, super specialized care. And what he finds really compelling is how different countries tackle this, how they actually do it. Reflects their own priorities, their values.
Exactly. And you see that variety everywhere. Look at the UK's NHS government runs the services, mostly. Then Germany, they have this statutory insurance model. Everybody pays in, everybody's covered, sort of.
Yeah.
And the U.S., well, that's a mix, isn't it? Public programs like Medicare, Medicaid, plus a lot of private providers. Very complex. But despite all these differences in structure, Bickerstaff points out this common thread, this shared mission underneath. It's about delivering health services fairly, equitably, and efficiently. He's very clear. He says healthcare is not a luxury. It's infrastructure. That's a powerful way to put it, especially if you're used to thinking of it just as, social welfare.
It is a powerful reframing. But, does that infrastructure view maybe risk downplaying the immediate human need, the urgency of care right now? How does he square that? Because it's so relevant today, isn't it? Global travel, people living longer, new diseases popping up all the time. It constantly tests our systems. COVID was a huge example, a brutal one. It showed the cracks, but also the strengths, especially, in places with robust public health foundations. It really drove home how universal access helps communities stay healthier, reduces those economic gaps, takes pressure off ERs. But Bickerstaff connects it even further. Better workforce productivity, kids doing better in school, stronger social bonds, it's all linked.
Well, Bickerstaff would probably argue that the human element is the infrastructure's purpose. That's the point. He'd say we often get stuck in just reacting. Crisis response mode. Seeing public health care as just fixing problems after they happen. But real public health, the effective stuff, he argues it's often invisible because it's preventing the crisis from happening at all. Think about, sanitation reforms back in the day. Wiped out diseases like cholera, huge public health win. But we barely think about it now because the crisis is gone for most of us. He keeps coming back to this idea. The future of prosperity hinges on the health of the people. Mm-hmm. Does that invisibility make it a harder sell, though? When budgets get tight, funding something you don't see directly.
Oh, absolutely. It's the classic prevention paradox, right? Hard to fund something working well because the problem isn't obvious. And this prevention idea, it's not just about feeling better. It morphs into this economic engine. Bickerstaff's really crunched the numbers on this. He pushes back hard against that idea that public health care is just a cost, a drain, and he presents it as a major economic driver. It employs millions, right? It fuels medical research. It actively tries to manage the overall cost of care. These systems cut down that economic drag. People too sick to work, chronic conditions left untreated, health-related poverty. That stuff costs a fortune.
Precisely. And while the critics always focus on the upfront spending, Bickerstaff points to study after study. Good public health care actually lowers cost in the long run. Think about the domino effect. Preventive care vaccinations, screenings means fewer expensive complications later. Getting help early often means shorter hospital stays, less intensive treatment. And importantly, when systems are coordinated, you cut down on waste. Repeated tests, inefficient processes. Bickerstaff highlights places like Canada, Sweden. They get great health outcomes, but their costs are relatively controlled. often through things like bulk buying drugs, strong primary care focus. Even in mixed systems like France, they use smart regulation, price transparency to keep things affordable, accessible, without killing off innovation. So yeah, coming from his finance background, Bickerstaff is adamant. Public health care, not just a line item cost. It's a smart investment. You see returns.
That cost versus investment idea brings us right back to that MLK quote, doesn't it? The moral side, the ethics. Access to care, Bickerstaff insists, it just shouldn't depend on where you live, how much you earn, your race, or if you have a job, period. But we know the reality. In so many places, huge gaps exist, stark disparities, and public health care has this absolutely central role in trying to close those gaps, to build a fairer society.
Totally. When we talk health, it's not only about doctors and clinics. It's tied so deeply to those social determinants, things like your housing situation, your education level, your income, the environment you live in. Bickerstaff argues that public health systems have to engage with these things to be truly effective. Maybe that means different government departments working together, putting health goals into city planning or education policy or economic strategy, not just waiting to treat the downstream effects in a hospital. And it definitely means tackling disparities head-on for racial minorities, ethnic groups, through targeted outreach, culturally sensitive care, collecting better data so we actually see the problems. So the real challenge Bickerstaff puts forward is this. If equity isn't just a nice-to-have, if it's the actual measure of success, how should we evaluate our systems? What are the right metrics? Integrated metrics.
That's a tough question. Really challenges how we usually think about success, right? And speaking of effectiveness, Bickerstaff constantly points to prevention. That's where public health care gets its biggest bang for the buck, its best ROI. We're talking population-wide stuff. Immunizations protecting whole communities, screenings that catch things early, good maternal care, sanitation systems, public education campaigns about health. These things save countless lives. And they slash long-term costs massively. Plus, there's all that invisible work public health departments do. Tracking diseases, making sure food and water are safe, being ready for emergencies, watching environmental health hazards, all crucial for keeping communities resilient.
And that's the foresight piece, isn't it, looking ahead? Bickerstaff really stresses that investing in the nuts and bolts, the labs, the data systems, the community clinics, that's about getting ready for the next crisis. Because it's not if another health emergency hits, it's when. And that readiness, built on a foundation of prevention, that's where public health care truly pays off, turning potential disasters into things we can actually manage.
You know, there's this common idea, this myth almost, that public systems are always slow, bureaucratic, that they kill innovation. But Bickerstaff really takes that on. He gives loads of examples. Government-backed research leading to huge breakthroughs. Vaccines, obviously, medical devices, and new ways of delivering care. He points out how public health data collected systematically, analyzed properly, has shaped so much. Cancer treatments, mental health approaches, often moving faster than purely market-driven efforts could.
That's right. And looking ahead, Bickerstaff is excited about digital health. It's becoming embedded. Mobile health records, using AI for diagnostics, telehealth, remote care. He highlights countries like Singapore, Estonia, the UK. They're really pushing the envelope here, showing what's possible when you have strong public infrastructure and invest strategically in digital. He also talks a lot about partnerships. Public systems bring the scale, the mission. Private partners can bring agility, specific tech. It's a powerful mix when it works well. Improves efficiency, saves lives. Especially thinking about personalized medicine driven by data.
Okay, let's zoom out globally for a second. It's obvious there's no single right way to do public health care, no one size fits all. But we can learn so much from different places. They're like real-world labs for Bickerstaff's ideas. Take Cuba, amazing health outcomes, really low spending per person. How? Well, partly by redefining the doctor's role, embedding health workers right in the community. Bickerstaff thinks even richer countries could learn from that for early intervention. Or Japan, longest life expectancies, universal insurance that encourages people to get checkups early. Then you look at the U.S., spends way more, but outcomes aren't always top tier. It's fragmented. Yet it's research hospitals, world-class, setting standards globally. It's complex.
It absolutely is. And what's really encouraging, I think, is seeing emerging economies. Rwanda, Thailand. They're showing that with strong leadership, you can transform public health pretty quickly, often using hybrid models, sometimes leapfrogging older systems by going straight to digital solutions. So, stepping back, Bickerstaff argues that even with all this diversity in how systems are set up, certain principles keep popping up in the successful ones. Equity, access, efficiency, resilience. Those seem to be the common threads, the core values, driving effective public health everywhere, whatever the specific model.
Of course, we have to be realistic. It's not all smooth sailing. There are real challenges, real obstacles. Public healthcare systems face valid criticisms. Bureaucracy, yes. Waiting times, definitely. Sometimes underfunding is chronic. Political meddling happens. Even corruption in some places. Outdated tech. Care not being available equally everywhere. But Bickerstaff makes this really crucial point, these flaws. They aren't reasons to give up on public health care. They're urgent reasons to improve it, to redesign it strategically.
Exactly. He sees these challenges more as catalysts, opportunities to evolve. Systems can't just stand still. They have to adapt. They have to listen to the people they serve, learn from what goes wrong. And that means you need strong governance. You need transparency. You need citizens involved, engaged in making reforms happen. He emphasizes that the goal isn't perfection. That's probably impossible. The goal is progress. Steady, meaningful improvement. Like maintaining any vital infrastructure, really. You see a pothole, you don't abandon the road network, right? You fix the pothole.
And right at the heart of fixing it, Bickerstaff argues, is leadership, human leadership. Visionary leaders, smart policy that's the pulse, the heartbeat of a public healthcare system that actually works well. Leaders set the direction. They decide where the money goes. They guide the changes. And often, the best ones work across different sectors, education, housing, environment, for that holistic approach to health. It's not just the health minister's job, it needs a whole-of-government mindset.
So true. And we saw the power of leadership so clearly during recent crises. Think about figures like Dr. Groham Brundtland globally or Dr. Anthony Fauci in the US. Their ability to communicate, to build trust based on science, it was critical. It showed how vital that credible leadership is when things get uncertain. Bickerstaff really zeroes in on policy frameworks too, ones that genuinely support universal coverage, that rely on data for decisions, that give local teams the autonomy to act. That's what empowers health workers on the ground. That's what makes leadership real and effective, improving services day to day.
Okay, so as we wrap up this deep dive, let's circle back to George Bickerstaff's core message. It's profound, really. Public health care ultimately is about how we value human life. It's more than just fixing bodies. It's about enabling people to live full lives, to contribute to age with dignity. It is, as he says, infrastructure. Essential infrastructure. So what does this all mean for you listening right now? Well, you have a role here, a vital one, in shaping this. Think about supporting funding, supporting thoughtful reform of public health where you are. Educate yourself. How does it work in your town, your country? How does it compare globally? Advocate for prevention. In your community, at work, encourage policies that put equity and access front and center. These actions matter. They add up.
Yeah, Bickerstaff's perspective really forces you to think long-term, doesn't it? If the strength of our society really is measured by the health of its people, and if public health is fundamental to national security, to economic planning, then the question becomes personal. How do you, as part of your community, contribute to this essential infrastructure? What steps can you take to advocate, to participate, to help build that healthier, more resilient future for everyone? It's definitely something worth mulling over, because ultimately the answers affect every single one of us.